Does it make a difference if you have your mouth closed or mouth open, even in just how you look? Well, think about it. Take a photo of yourself with your mouth closed and then have your mouth open. When Hollywood is doing a video or a movie about a less intelligent individual, normally they portray that individual as a mouth breather. The individual typically has a longer face, jaws that are set back. I don't mean this in a bad way because I have those characteristics, and the reason that my face looks like that my nose is bent and my jaw is set back and my lower jaw is set back, is because I had my mouth open so much as a kid and as a teenager and as a young adult. And you can't get away with this one. So from an aesthetic point of view, but also from a functional point of view, meaning that when your face develops the way it should develop, not only does it look better, you just function better because your sleep is better, your airway is better, it's easier for you to breathe. I'd really encourage any parent listening to this that pay attention to your child. And if you see your child is persistently having the mouth hanging open, it's very important to look for help there. It's never about forcing nasal breathing with the child because, the reason that the child has the mouth open could be enlarged adenoids. But also maybe that the child has a stuffy nose. Now, a stuffy nose, we can help. Switching to nasal breathing, we can help. Enlarged adenoids, we can't help. That's going to be the role of a dentist who understands about airway or an ear, nose and throat doctor. But ultimately, for improved sleep quality, we need good breathing. And good breathing starts with breathing freely, in and out, through the nose, without limitation. In other words, without restriction, without resistance. So the first sign that there's some resistance to your breathing during sleep is when you start hearing your breathing. You might just start hearing your breathing as so. So you're hearing your breathing, but airflow may not be restricted there, so it may not be too bad. It's not ideal for a kid, but it's probably not that bad for an adult. And the second resistance to breathing is then when you start hearing turbulence in the nasal airway, especially if the person is nasal breathing, and it will go like this. And if that resistance to breathing increases to the point that it restricts airflow, well, oxygen is not going to transfer so readily from the lungs into the blood because airflow is restricted, and that's called a hypopnea. That can cause you to be aroused from deep sleep, so you don't spend so much time in deep sleep and you spend more time in light sleep and you wake up feeling unrefreshed. Now, if we take that resistance one step further and you stop breathing altogether, so you might have that's an apnea. And if it lasts for 10 seconds or more, it's one apnea. And during that time, blood oxygen saturation is dropping, carbon dioxide is increasing, and the person is being aroused out of deep sleep. But also their body and mind is put into an increased stress response. And if you think of it this way, the brain cares for itself. The brain needs a lot of oxygen. And if you as a sleeper, if you're stopping breathing during sleep, or if your child is stopping breathing during sleep, your brain is going to take you out of deep sleep to make sure that you resume breathing. So your sleep quality is going to be sacrificed to make sure that there's enough oxygen getting to the brain. So if you're waking up feeling tired, if your child is sleepy, if your child has difficulty with concentration and difficulty with attention, if your child is a mouth breather, that's something to be looking into. That's what we've been working with at MyoTape Clinic for quite a number of years, 22 years so far. Now, I started this talking about the shape of the face, but of course the shape of the face is going to influence your sleep. And that's why it's very, very important. So aesthetics aside, we have to think about function. Now, of course, it's nice. Of course, it's very important that our face develops the way nature intended. And that happens when your mouth is closed, your tongue is resting on the roof of the mouth, and it's the pressure exerted by your tongue in the roof of the mouth that helps to direct the shape and the direction of the maxilla, which is the top jaw. So with mouth closed, tongue resting on the roof of the mouth, you typically have a wider facial structure. You also typically have forward growth of the jaws, and when you have forward growth of the jaws, you have a bigger airway. It's easier to breathe through. You have improved sleep quality, and you have everything else that goes with it. So beauty is not just skin deep. You have to think about sleep, and we have to pay attention. If you're a child, if you're a teenager, if you're an adult, doesn't matter. Start now, breathing in and out through your nose, tongue resting on the roof of the mouth. Download our apps. They're free. Free instruction. We have free children's instruction. Look at the kids corner on MyoTape.com. So there's no excuse. Breathing starts here. Never wake up with a dry mouth in the morning.